Does CJC-1295 work? Well, does it actually work, or is it just another peptide trend with a great story and weak evidence? Well, here's the real answer. CJC-1295 is documented to activate growth hormone and the IGF-1 axis in humans. Whether it works or not depends on what you're measuring. And the wrong question is, did I feel something? The better question is, did my biology move in the direction we intended? And did my labs confirm it? So, apply the scientific method. You guys remember, it's like, have a hypothesis. I hypothesize CJC-1295 is going to help improve my IGF-1 numbers and my insulin fasting, and I'm going to have more muscle mass. And so then you'd run a DEXA scan before, you'd look at your blood labs before, and then you'd see what happens over the course of 90 days. See if it works. But really, if you look at the mechanism of action of CJC, I think that's probably the reason why you asked this question, which I would be asking too. Like, is CJC something I should pay attention to? Because there's a lot of different noise out there. So if you think of CJC, it's well documented to work because what it does is it's creating signal through the noise. And that's where a lot of you are asking the question, like, are peptides right for me? I want to look, feel, and perform my best, but is CJC something I should pay attention to? Well, this video will help you separate the signal through the noise, because CJC absolutely does work. And I've got multiple videos on this, and there's very compelling evidence that it does increase your IGF-1 levels. It's measurable. And so the mechanism matters because growth hormone is not the final destination. Like, why do you want growth hormone? Well, it signals the liver and the other tissues to start producing IGF-1, and that's one of the things that you want. As we age, our IGF-1 levels drop substantially. And these downstream markers, when it comes to recovery, repair, sleep, body composition, and aging, the lower your IGF-1 levels, the greater risk you have of premature aging. And so in randomized placebo-controlled double-blind study, this was in healthy adults ages 21 to 61, CJC-1295 increased mean plasma growth hormone by 2 to 10-fold for 6 days or more after a single injection. And it increased IGF-1 by 1.5 to 3-fold for 9 to 11 days. So this same study, it estimated the half-life of 5.1 to 8.1 days. Now, there's no reported serious adverse reactions in that short-term trial. A second study in healthy men found that CJC-1295 increased mean growth hormone, increased through growth hormone and increased IGF-1 while preserving pulsatile growth hormone secretion 1 week after administration. Now, that's important because the pulsatility, like, you don't want growth hormone expressed all the time. Growth hormone has a braking system called somatostatin, so when somatostatin's present, growth hormone can't get released, but once you pull somatostatin off, now growth hormone is expressed. The other hormone that does seem to block the receptors that IGF-1 works on directly is insulin. And so this is one of the reasons why many people don't notice a benefit of CJC-1295, because they do it the right way. They get it from a 503A licensed compounding pharmacy. Their doctor prescribes it, but they fail to read the instructions. And the instructions will say, use this 90 minutes after your last meal in the evening before bed, or use it first thing in the morning in a fasted state, and then wait at least 30 minutes to eat after that. And people will not use it properly, and then insulin is now in competition with the IGF-1. So in these studies, what they're finding is you'll find that there's this nice constant pulsatility that can happen as you sleep or after you work out, and that's the real thing that we want to look for. So at Ageless Future, we run an operating system on everyone we work with. We only use 503A licensed pharmacists, compounding facilities, FDA overseen, so that we make sure that you're getting the right molecule. And so the very first thing we want to do is, before anyone gets prescribed CJC-1295, look at your IGF-1, your fasting insulin. We also want to look at your hemoglobin A1C, all your lipids, your apolipoprotein B, your apolipoprotein a. We want to look at your CMP, your liver enzymes, kidney markers, thyroid markers, high sensitivity C C-reactive protein, CBC, PSA, and then look at all the hormones downstream. So the target is not more growth hormone, the target's better signaling so that your body now has the ability to be reminded to produce growth hormone on its own. And when your growth hormone and IGF-1 axis is underactive or overactive or dysregulated, we also want to find if it's in a healthy range. And so the very first thing you want to do is evaluate CJC-1295. Does it work? Yes, it absolutely works at increasing the IGF-1, but you want to look at the whole mechanism. Just by increasing IGF-1, did you even notice a difference? Do you notice you're sleeping better? How's your resting heart rate? What's your mile time? How many of you have like cardiovascular metrics? How's your VO2 max? Did you have an uptick in some of the metrics that you're looking to optimize? But if you're just looking like, does CJC work just to see if you feel different, I could tell you feeling is not a diagnosis. A lot of people feel great the day before a heart attack, the day before a cancer diagnosis, but the real thing that you want to do is look at the data. And so one thing that you'll notice as far as side effects go from some of these growth hormone releasing peptides is you may see a glucose response. Your blood sugar may temporarily get elevated. You may see water pressure, water retention build up. So notice a little swelling in your ankles or in your little puffiness in your face. You may see an increase in blood pressure. Small percentage of people have an increase in blood pressure. You want to look at your sleep quality. While most people end up enjoying more deep sleep and they feel like a kid again when they wake up, some people do worse, and some people have joint symptoms, carpal tunnel-like symptoms. These are all very well documented side effects of exogenous growth hormone or human growth hormone. But overall, you want to look at one of the biggest side effects is if you have an autoimmune condition or immunogenic tendency, you may get a massive flushing from CJC-1295, and that flushing is dangerous because for some of you, you may think you're having a heart attack, but the flushing's totally normal, lasts about 5 minutes, and it's just your body's immune system recognizing this new protein that's now turning on the signal in your pituitary to release more growth hormone. The other thing we have to look out for is if your IGF-1 rises too high and glucose worsens or blood pressure changes, symptoms appear, that's not a success signal. That's a returning signal. It's where, okay, we needed to fix some things before we ever started working on the growth hormone pathway. So clinically, yes, we do know that if you have healthy IGF-1 levels and healthy growth hormone, you're going to have anti-aging benefits, you'll have fat loss, you'll build muscle. Really what we're looking at is how does it work with you specifically? Just because, one of your friends had good results with it doesn't mean you will. And so anytime you're looking at compounds like CJC-1295, this is not FDA approved for any conditions, but you want to look at the long-term benefits and the safety. And so when you're looking at using something like this, only use 503A compounding pharmacy. Do not use research use only peptides. Do not use if it has DAC included or drug affinity complex. The side effects are going to be astronomically higher. And so the deeper insight is CJC-1295. It's not about forcing growth. It's about asking the body whether it has the capacity to hear a growth repair signal and then respond coherently. In a younger system, repair signals rise and fall like a rhythm. In an aged or stressed system, the rhythm can become quieter, noisier, or mistimed. And so the future self question is not, how do I push my body harder? It is, can I restore the signal quality that lets repair happen at the right time, in the right tissue, with the right feedback? And so for those of you who are looking to find out if this is the signal that your body needs, and you want to work with licensed providers who only use 503A compounding pharmacies, go to agelessfuture.com, set up your free intro call, and my team will take great care of you. I'm Regan Archibald. Thanks for being on the channel. Love to hear your comments on what your experience has been with CJC-1295. See you on the next video.